I want to take a quick spin into my space of training, which is orthopedics. In the areas where I've seen what I think is similar technology, and maybe you were involved in this, we'll find out. Um, we did do some skin work, some skin grafts, and and there were some. I believe there were some cell growth that was then sent back to us in that space, but I didn't really manage those patients. Where I saw this used was in the cartilage space. And so were you involved in any cartilage research in
Yes,
growing and expanding
absolutely.
cartilage cells?
Yes, we have been. We do have patients where we've treated in that manner as well for cartilage.
So, because cartilage cells are there, I guess they're all unique, but cartilage cells are, in my world, unique, because traditionally, once they're gone, they're gone. And, if someone has osteoarthritis, their cartilage is degrading and it's falling apart, and, there's not much you can do other than replace the joint, which joint replacements are amazing when they go great, and when they don't go great, they're not a lot of fun. But the demand for joints and the time frame for joints, people are needing joints earlier and earlier. So, do you think that there is a future where we could potentially replace cartilage on the end of a bone for someone that has osteoarthritis?
Yeah, so we have done some studies. We published those studies in the journal Science Advances just recently, which is the sister journal of the journal Science, basically looking at doing just that. So what we do is we take cells from the patient, and we then you know use very different cocktails to drive the cells towards a cartilage lineage that then goes into the knee area, showing that the cartilage does get regenerated, and you can actually even decrease the bone erosion by using some of these strategies. And that's just a phase one pilot trial of 10 patients that was done, showing cartilage formation, decreased pain, increased quality of life, increased functional daily living. Um, it's still in their trials, right? So we still have a lot more work to do, and it's under limited trials. So again, offering it to patients, but under limited conditions under each trial, and then hopefully pushing through to treat more and more patients someday.
Yeah. The scenario that we used it in, was probably a little bit different because this was a commercially available product, and I remember very clearly if you had a defect that was symptomatic, that you could create, up to like a 1 centimeter. I mean, we're talking small, right? You could sort of hollow out that defect and then fill it with cells, even potentially the patient's own cells, if we were to, pull them out and send them out and have them come back. And it did work, but it was protected because it was in an isolated area, right? So we could do these like chondral defects, but there was never an opportunity for us to, do a large area for someone that had significant arthritis. And that would be, I mean, gosh, it would be such a game changer from a function perspective, from an aging perspective to be able to treat that.
Yeah, yeah, it's interesting. You have more experience with your specialty, of course, but it's interesting, right? So many orthopedic injuries and knees and hips and joints. So cartilage is very much needed for patients, as you know, and so we are really working hard to try to get that pushed through and to get more patients treated.
Yeah, I look forward to that. I want to turn the conversation a little bit and chat about the ethical piece of this because when you say the word stem cell, and actually maybe we should define stem cell. But when you say the word stem cell, some people's, the hair on their back stands up and they start getting really they start getting really defensive. But maybe let's define stem cell because what's out there commercially that are things that are called stem cells, you and I may not call stem cells. So for us, can you define stem cell as you see it?
Absolutely. So a true stem cell is a cell that can go into many different directions, and in reality, uh, there are only a few cell types, only three cell types that can give rise to all three germ layers, which are the all three tissue types that are present in the body. It's called ectoderm, mesoderm, endoderm medically, but those three layers embryologically in embryos give rise to pretty much every tissue type in the body. And basically, there are only a few sources for that. Human embryonic stem cells, of course, which is probably what you're referring to in terms of the ethical implications it had when it was first introduced, um, because you're sacrificing these, infertility driven embryos, which are about the size of a pinhead each. Uh, but then what they would do is, when moms were using freezing eggs, fertilized eggs for infertility purposes, if they did not use all their eggs, some of them got discarded. They're about the size of a pinhead each. You crack open that egg. There's about 100 cells in there. Those are your human embryonic stem cells. However, what people did not really know readily when this whole debate went was that those cells, by definition, form tumors. And it's the same thing with what's called induced pluripotent stem cells, which is a second cell type, which can be derived from adult patients, and they can be derived from the skin, for example. And by using genes, you can revert that to a human embryonic-like stem cell. And unfortunately, those cells also have the potential to form tumors. In fact, those two cells are the only ones that could be called pluripotent. And when the National Institutes of Health first came out with a definition for a pluripotent stem cell, which means it could go into all three germ layers, you couldn't call it that unless they form tumors. That was the scientific definition. And then more recently, in our labs, we found a stem cell that can be derived from the placenta, or the amniotic fluid. The amniotic fluid being the fluid that bathes the developing baby in the womb, or the placenta being the afterbirth. And you can just get these cells right after the baby is born. And these cells are very, very powerful. So we identified one specific cell type using a marker that drives those cells to go into all three germ layers as well. But with the exception that they do not form the tumors because they're not as primitive as human embryonic and iPS cells. So those are really the only cell types that can give rise to all three germ layers and really have that potential to do so. So that's what we call stem cells. Other people are adult stem cells. There's a name for adult stem cells, and that's typically cells from cord blood or from bone marrow or from fat or other adult sources. But these cells are basically mesenchymal only. They only go into one of those three layers. So instead of going to all those three layers, ectoderm, mesoderm, endoderm, they only go to mesenchymal cells, which is a much more limited cell type. They have limited growth potential. They don't expand very rapidly. They don't turn into many things. And so they're much more limited in what they can do. And in a nutshell, that's all you need to know about stem cells in
Well, no,
general.
that's fantastic. No, it's a great background. And so, I mean, when I look at the stem cell market, as it were, things that are commercially available, because in the orthopedic space, we cross over into regenerative medicine, and there's a lot of people out there talking stem cells. Get your stem cells. And in the US, we're very limited, right? So in the US, correct me if I'm wrong, but the only quote unquote stem cells that someone can commercially provide are either going to come from bone marrow or from adipose tissue. Are placental amniotic cells, are they allowed by the FDA at this point?
So there are some trials with placental stem cells. Now, the interesting thing with the placenta, I just mentioned the placenta, but placenta cells also have mesenchymal cells. So you have to isolate the unique cell in the placenta that does give rise to all three germ layers. So the placenta is unique because it can act like cord blood. Most of the placenta that you see out there, in fact, almost all of it that you see out there is basically just mesenchymal. You need this specific marker to allow this one specific cell type that actually goes into all three germ layers. But that makes it even more confusing because when you say placenta, it just doesn't mean that it's the
What do you mean?
true.
Yeah, right.
Yeah. What are you meaning mesenchymal, or are you really meaning highly multipotent?
Well, and let's maybe talk about these mesenchymal cells that are gonna be available through, like, bone marrow. Like, for example, I did surgeries where we would do bone marrow aspirate, and we would spin it down, and we would put certain parts back in and hope that it healed better, which I think it probably did. But what are the use cases that you're aware of for the mesenchymal stem cells compared to what you're talking about?
So mesenchymal cells are interesting, right? Because the mesenchymal cells, uh, when you put them inside the body, they're pretty much gone within 48 hours. So that's the thing to know about those cells. So when you're looking at those, because I'm sure you've seen, I would just say buyer beware because, you see these stem cell clinics that are propping up and the FDA just could not shut them quickly enough. And this is, I'm talking about these clinics that they're out there and say they claim they can cure everything, right? From Alzheimer's to Parkinson's to orthopedic issues to heart issues. You have beware because actually orthopedic issues as well. Some of the challenges with that is that those cells go inside the body and within 24 hours, 99% of those cells are gone. Within 48 hours, 100% of those cells are gone. They do not stay behind and they're not really regenerating. However, those cells do have, some of those cells do have the potential to act as an anti-inflammatory agents that can change the inflammatory response and get you back in the right direction. So there are benefits to these cells. It's just that people are not necessarily um, applying these cells, making sure that patients understand what is it that they're really getting. Are they getting cells that are actually regenerating tissue, or are they getting cells that actually are modifying the inflammation in the body? And I think that's a big differentiating factor. And some of these clinics are charging, five, 10, $20,000 for that treatment. And many times, as you know, as an orthopedic surgeon, that a steroid shot may end up doing the same thing in terms of the pain relief. So buyer beware. There are cells that will do some good. There are cells that will not do, that have limited potential.
Yeah. And we can just from the audience perspective separate this from something like PRP, which is a totally different conversation. There's a fraction of of the blood that is, in my opinion, also more anti-inflammatory than anything else. Are you familiar? Have you done any work with PRP?
Absolutely, absolutely. We've done, we've tested in the laboratory, to try to elucidate some of its mechanisms of action. And again, the cells can be anti-inflammatory. Um, so there's this whole basic, this all these cells, right? Like you mentioned, coming from fat or coming from bone marrow or cord or PRP, a segment of those cells, which we don't call stem cells, but they are a segment of blood. All these cells really have a lot in common in that they can act as an anti-inflammatory, and but then the challenge you have is that uh, there's a lot of variability because not every cell you take from everybody is going to be the same, and so those patients are different. So you do see a lot of variability in terms of the effectiveness of these cells in therapy because it depends who you're getting them from. And so there's some usefulness to it, but you need to really go to a reputable physician and clinic that's doing this the right way.
Yeah, well, absolutely. And so what do you think then of the conversation around people traveling internationally? Because I hear this a lot. I spend some time in the longevity space, the anti-aging space. I find it fascinating. But the further you get into the anti-aging and longevity space, the more you get into science that isn't science, and it's really marketing wrapped around technology development, which I think there's space for that, right? Like there are some really smart people making really great products that will likely eventually help maybe some of us. But it gets really murky really fast. And in this space, we see people that are traveling, across the border where the FDA doesn't have any control, and they're getting stem cell injections. They're getting embryonic stem cells injected into parts of their body, into joints, into whatever. Is this a good idea?
You know, so basically, we come from a world of science, right? And you know that any time that we put something through the FDA, it has to be tested extensively. And you have to have all the release criteria, and you have to show proof of safety, and you have to show proof of efficacy before you're put into a patient. So there's nothing like an FDA approved trial for you to feel confident that at least everything is being done that's possible to give you the outcomes that you are expecting. If you're going after these treatments that have never had that have not had this type of approval process, they don't have the science behind it. They have not published papers on it. They don't. You're basically just trying things that you think may work. Uh, and the other thing to consider, which is very very important, which I always like to talk about in our scientific sessions and meetings, is the placebo effect. Right? As you know, all these studies, including, I'll go back to some of the orthopedic studies where they were doing the studies with some of these injectables in the knee that 35% of the patients felt better just if you put saline alone, uh, just water with salt in it. So the placebo effect is very high. And so the placebo effect is typically 30%. So 30% of the patients are going to feel better no matter what you put in. And so you have to really be careful when you are seeking therapies that do not have the scientific backing necessary, that is just a promise as opposed to reality. When you put something through the FDA, you have to go through years of, scientific experiments using all kinds of systems to show that these technologies are doing what you're saying you're doing. So I would say again, buyer beware.